Okay. Hello. Wait, are we on? Yes. Hello. I always laugh because every time we do this, it's like, oh, are we on? Are we on? Hi, everyone. Welcome. Hi. Welcome. We have Noodle and we have our special guest, Nurse Bug is here. Yay! Come closer over here, Nurse Bug, so Noodle can come closer in the thing. Welcome. It is live with Dr. S, live from your interventional and vascular care in beautiful Garden City, New York, at our office. Thank you for joining. Now, Tiffany is hard at work over there. She's not working while we're doing TikTok live. Your and Tiffany's job is you have to say hi to the people when they come. Nobody's there yet, so. But when they come in, you say hi.
I feel like that half the time.
Oh, you do good. I'm trying to.
Abby's really good at it.
Yeah, Abby's
She like
okay. She likes to say hi. I wonder if she's out there listening. Hi, Abby. Abby's not here with us today, but she'll be back tomorrow. Anyway, so Nurse Bug, in honor of your presence here, would you like to announce the topics for this evening?
Today we're going to talk about hair loss treatments to help it grow back and hemorrhoids. Woo!
Do you have hemorrhoids, Nurse Bug? No, I'm just kidding. Not. Yes, so August is National Hair Loss Awareness Month, and we're going to talk about hair loss because it is something that men and women both have, and it can be very distressing. And there are treatments and supplements, natural supplements that you can take to technical difficulties to help with hair loss. And then also we're going to talk. So that's usually Nurse Bug watches the TikTok, so you know this. But usually we talk about a cosmetic and we talk about an IR procedure. So for the IR procedure this evening, we are going to talk about hemorrhoid artery embolization. So it's not the sexiest topic in the world, but it is
Sounds sexy when you said
it. It is an important topic because, again, almost like people were like, well, why are you going to do hair loss and hemorrhoids? It's a weird combination. But you know what? I feel like both are kind of.
yeah, that is. Sorry, my brain is broken.
I feel like they're both kind of taboo topics to talk about. Like people are embarrassed, so they don't really discuss it with other people. Maybe family members. Sometimes patients will come into the doctor's office and they don't totally feel comfortable discussing that sort of stuff, even with their doctor. So, hair loss is a source of stress and embarrassment for some people. And I feel like, hemorrhoids are also a source of stress and discomfort and both reduce quality of life. So there is method to my madness, kiddos. Okay, it doesn't really. But anyway. So yes, we're going to talk about hair loss and we're going to talk about hemorrhoids. So there are different causes of hair loss. Do you know some of the causes of hair loss, Nurse Bug? Or Noodle? Or Noodle?
I was ready to raise my hand. Stress.
Yes.
Hormonal changes.
Yes. What else?
Let me think. No, because I'll be also hormones. Like low on vitamins, what else is hormonal changes?
Yeah, like nutritional. Yeah. Those are big,
Climate change. Oh, if it being too hot, it maybe you'll lose your hair. It burns off. No. People that have alopecia, so a genetic thing.
Yes, genetics, alopecia.
Okay.
Hey, Cheaty.
Oh, somebody joined.
Oh, okay. You have to say hello. Hi, welcome to Live with Dr. S with Nurse Bug and Noodles. Yes, no, those are very good. You guys both got lots of causes. So Causes of hair loss, yes, it could be genetic. That's what we talk about. We hear about male pattern baldness or female pattern baldness. It's called androgenetic alopecia, and that's what is associated with DHT, which is dihydrotestosterone. So it's a hereditary sensitivity to that, and so that will cause hair loss. And it can happen in men and women. So, yes, that is one of them. Another one, hormonal imbalances, postpartum, postmenopausal, and this isn't really hormones, but post-COVID. Lots and lots of people have COVID and they have hair loss. And, look, a postpartum, like a little bit of hair loss is normal. But if it's a continued hair loss and it keeps going on and on, that isn't necessarily normal. So, yes, stress, stress pretty much affects everything in our bodies. Emotional stress, surgery, a stressful illness. I guess post-COVID would fall under the stressful illness category, but it can cause temporary loss of hair growth. But, if it becomes a chronic thing longer than temporary, then yes, that is a problem. Nutritional deficiencies, I think that's what you were trying to say. So lack of iron, zinc, vitamin D, B vitamins, especially B vitamins, so biotin and B12, those are for your hair. That can also, and protein deficiency, like people, if you don't like to eat protein, especially with, it kind of ties in with the weight loss drugs, everybody who's using all the new weight loss drugs. That's why it's important to try and, do it under the direction of a physician, because if you are not eating and you're not getting your protein and proper nutrients in, that can also, attribute to hair loss. Different medications, medical treatments for other things, blood thinners, blood pressure medicine, hormonal meds, those can all, lead to hair loss. Autoimmune conditions. So there are autoimmune alopecias that, will be hair loss. Hi, welcome. Welcome, King Zablon. I'm not sure, but hi, welcome. Scalp conditions. So inflammation, conditions like seborrheic dermatitis, psoriasis, fungal infection. That's, what the fungal infection is. Come on, nice bud. You're down south, you know what it is. Ringworm.
It's like on your feet?
Yeah. Well,
you have to do your hair.
We're calling it ringworm, but it's fungal. Yeah, what?
You think it is?
You cannot?
Yeah.
You can. That can cause hair loss. Yeah, absolutely. Hairstyle practices. So, girls, women who like to tie their hair back really tight all the time, that can cause hair loss, around the why am I losing my
front
words? Yep. It's technically the hairline,
If you want to talk about that too.
Hello. I'm losing hair off of my frontal lobe. The hairline. So if you tie your hair back tight, like all the time, like, you know what I mean? Like those super tight, like ponytails and buns, like that's not good. And then also, women who have braids, who get braids, because that's weight and that's tension. So that's called tension or traction alopecia. So that can cause hair loss. A lot of times, if you just stop doing the tight ponytails and if you take the braids out, it could help, but it might not, so you might need extra help along the grow back of hair. And then, of course, there's just natural aging, as we get older, our hair. As I talk to the 25-year-old and the soon-to-be 25-year-old. Side note, Nurse Bug turns 25 on Saturday. Yay. Everybody wish her a happy birthday in the chat. Anyway, they're not losing hair. I'm closer to hair loss than they are. But anyway, so what can you do for hair loss? So there have been, over the years, many different treatments. People go and they get hair transplants, which works well. And if you have the money and you want to do it and go through, it can be painful, etc. But if you want to do that, you can go and get a hair transplant. But I always tell people it's important to understand that whatever process is causing your hair to fall out when you get hair transplants, that process is still going on. So a lot of people will get the hair transplants, and then 10 years later, they'll say, what happened? My hair is falling out again and I got transplants. It's because the new follicles, right? Well, the new follicles that you're putting in are being affected. Like if you have male pattern baldness or female pattern baldness, that DHT, that sensitivity is not going away. So even with the transplants, lots of people talk about PRP. So you guys know what PRP is?
Plasma. And they use your plasma to inject through.
Right. And you know what PRP is? So a lot of people know of it as like the vampire facials, right? You take your blood, you spin it down, you get PRP, which is stem cells. And so they'll also use it for hair growth for your scalp. Unfortunately though, and I've never had it done and I've never done it, but I have heard from patients, many people, it's very, very painful. Very painful. And it also causes hair breakage. So people don't love to do it. So one of the treatments that I have here in the office, which is pretty amazing, it's from Alma, which is the company, and it's called TED. And TED is an acronym, so it's TED, and it stands for Trans-Epidermal Delivery.
Did not think that one.
Hi, welcome. Oh, there's Love Benny and Pillar Star Farms. Hi, welcome. So, yes, trans-epidermal delivery. Does anybody want to take a shot at what trans-epidermal delivery means?
Epidermal. Yeah, it's epidermal.
Yes.
And then what was
trans-epidermal?
Yeah,
so trans means across. Epidermal is,
and then they deliver the success.
Exactly. But do you guys know how we do it? Like how do we do this?
Collaboration.
Yes. Yes. Basically, it's high frequency ultrasound. So it's like there's a specialized tip and it's ultrasound and it vibrates at a really, really, really high frequency. And they found out with research that when you rub the tip on your epidermis, what it does is our skin is a barrier and it's built to be a barrier. And what it does is that high frequency ultrasound helps to open up the barrier and it creates pores so that certain size nutrients can get in through that barrier, which is your epidermis. So, and it's completely painless. So the only thing, I've done it to myself, so I know, and I've done it to other people. Mm-hmm. I always like to try things on myself so that I know what my patients are going through. And it's completely painless. The only thing is you might hear some buzzing in your ears.
Oh, really?
Yeah. During the treatment, because, it's vibrating at that high frequency and if you're rubbing it on the scalp, mm-hmm. your bone transmits sound, so that's why you might hear some buzzing in your ears. But it's really cool because it's painless. We can do it on scalp, eyebrows, beards. Yeah.
Wow, a lot of people need that though.
Yeah. Well, sometimes men will have like a patch, missing, and so they'll come in, and like if a guy comes in and he wants his head, and he'll be like, oh, like this, I'll be like, okay, we'll get a little left over, we'll save a little, and then we'll do like a patch spot. So, yeah. So, yes, that's basically, it's FDA cleared, non-invasive, it's high frequency ultrasound, and what it does is it creates, using those acoustic waves, it creates microchannels using acoustic wave and air pressure. And so what we do is the whole treatment takes about 30 minutes. And what I do is if we're doing your head, we mark off the areas that you want done. And, we rub the ultrasound, the high frequency ultrasound to open up the micropores. And then the special peptide and growth serum that we have, that's from the company, we put that on. And then we use the high frequency ultrasound again on top of the serum to push the serum in through the pores so that it's penetrating and getting in there deep. Treatments for men, literally about 20 minutes. Women a little longer because we have long hair, unless we have short hair, but anywhere between 20 and 30 minutes. And we always start with 3 sessions because that's kind of the protocol, the scientific protocol that the company, all the research that they did came up with, 3 treatment sessions to be the best, to get your best results. Mm-hmm. We do 1 session a month for 3 months in a row. And then, you come back 3 months later, we check it out. A lot of patients are so excited and they love it so much. They want to go through another 3-session package. Otherwise, we can do maintenance. Now, again, it's important to remember that whatever is causing your hair loss we're not fixing it, we're not curing it. So people will ask, do I have to do maintenance? Yes. So like with anything, you have to do maintenance. So a lot of patients will come back once every 6 months, once a year or twice a year, and we'll do one session and we'll do, maintenance. Now, with anything, stuff is usually, it's best to attack it with multiple things, So, we're doing the external, but then we also do the nutrition. So here, you can see behind us, we use Nutrafol, which is all natural. And it's a really amazing combination. So between the TED and the Nutrafol, we're attacking. The Nutrafol is really excellent because it's got lots of great stuff in it. So it's like a vitamin, and also it helps with the hair growth. And then with the external topical with the TED, it really we get fantastic results with it. So benefits and results with the TED, 98% of patients, they will see reduced shedding. So the shedding that you see that, you're getting every day, the first sign you'll see, and this is with Nutrafol also, you'll see that the shedding stops. And then even after the first treatment, patients will see hair growth. We'll see new hair growth. You'll see new hair growth. You'll see the density improve. And then, of course, you get your top results after 3 sessions. And like I said, completely painless. And you'll start seeing results within 2 weeks of the first session. So pros, quick, comfortable, no downtime. All you have to do is come here with clean hair and a clean scalp. And that's it. Pro, delivers active serum deep into your scalp. Yeah, that's pretty much it. Somebody who is completely and totally bald, bald. Yeah, no, that's nothing really. Rock your baldness and love it. There's nothing, somebody who's completely and they've started shaving or whatever, I think they understand that it's not going to. But this is great for, you're getting receding hairline, or you're getting the receding hairline there, or you're getting, the bald patch back here. Why are you laughing? Ring. Oh yeah, Kensley's dad. Hey Clay, are you out there? Is he? No, it's not. Is Donna?
I think Lizzie's on. Mom's on.
Hi, Lizzie. Tell Clay to come. No, I'm just gonna don't. Anyway, I know all of that. So with anything cosmetic, best thing to do is, I always tell patients when they come in for cosmetic stuff, it took you 40-something years to get here. It's not going to take one thing to reverse the whole thing, right? Oh, hi, Lizzie. She's there. Hi. That's Bug's sister. No, aunt. Is Gunner there? Oh, is Gunner watching? Hi, Gunner. So what was I saying? I lost my train of thought. I got excited by Lizzie and Gunner.
What was I 40 saying? Years.
Oh yeah. It took you 40-something years to get to where you are. One of nothing is gonna reverse everything. So again, with hair, it's best to do combinations. So here I really love Nutrafol. There's minoxidil out there. A lot of people don't like using minoxidil because oh, I see Fox. It takes Bug to be on the screen for you to show up. Oh, that's fine. Hi, Fox. That is old IR tech. We used to work with. Yeah. He's a nice guy. We like Fox. Yeah, Nutrafol is really great because it's all natural. So minoxidil, a lot of men don't like using it because it causes problems with fertility. And a lot of women don't like using it because it causes hair growth in places other than your head.
Oh.
Yeah. Like hair growth here and stuff like that. So, and then also, some people, they just don't want to take a chemical. So Nutrafol is awesome because it is all natural. It's FDA cleared. It's called a nutraceutical. So it was physician formulated. It's a supplement. A lot of people use it as their vitamin because it has so many great, like fantastic things in it that's like their multivitamin, and they'll just use that. But it has really specific ingredients that target hormone stress, inflammation, nutritional deficiencies, aging, your metabolic health. And as you can see, I don't know if you can see behind Bug, but they have different formulas, which is really nice because the premenopausal woman is different from the postmenopausal woman, is different than the man. And so, I tell patients, and this is another thing with any sort of cosmetic stuff, skincare or the Nutrafol, you have to stick with it. You can't do something for 1 month and again expect everything to reverse. So with the Nutrafol, I usually tell patients, please try and stick with it for 6 months because the first 3 months you'll see the reduce in shedding. So like you'll stop shedding so much. And then the next 3 months, you will actually see new hair growth. And so, and I know people who have been on Nutrafol for years and years, like when it first came out, and swear by it, like just swear by it. And we have patients here who purchase it and come in, and they'll tell me they're like, "Oh yeah, it stops the shedding." And you know, now, yeah. So it's really great, and it's all natural. That's pretty much it. So Nutrafol. Pros, all natural, drug-free, easy to get into a routine. You can take it as your vitamins, tailored formulas for women, pre-menopause, post-menopause, postpartum. They even have vegan formulas for the vegans out there.
Oh, really?
Yeah.
So what do they supplement the protein with?
You can use like plant proteins and stuff like that. And so, yeah, and that's pretty much it. And if you want to get Nutrafol, you can order it through, you have to order it through a physician. So again, you can click the link in the bio or whatnot, and you can order stuff through my office. That goes for the skincare and the Nutrafol. But if you come to the office, I am allowed to sell it at a big discount because I'm a physician. So come on by and we'll give you a big giant discount. Oh, and you guys want to tell them about
the 10% discount?
In honor of it being, so August is National Hair Loss Awareness Month, and in honor of it being National Hair Loss Awareness Month, all new TED packages, which includes 3 TED sessions and 3 months of Nutrafol, we are doing a 10% discount. So yay!
Enjoy the discount while you can.
All for hi Donna. Welcome. She's doing okay. She's still alive. She's all right. All right, Bug. Do you have Bug? Do you have any questions? No.
No questions at the moment.
No. Okay. All right. So, if you're gonna go see a physician about your hair loss, she's so cute. If you're gonna go see a physician about your hair loss, you can get your blood work checked. We want to make sure you don't have iron deficiency, D vitamin deficiency, thyroid that, can throw things off. You want to make sure you have good scalp health, hormonal history, stress matters. Nutrafol has specific ingredients that will help with stress. And, don't be embarrassed. That's what we're here for. So again, as always, you can put questions in the chat. I won't say your name. If you say, don't say my name, I won't say your name out loud. I'll just answer your question. If you want to DM me privately, I'll answer your questions. And so you can always ask me anything. So you guys, should we move on to the next topic?
Yes. Yes.
Are you going to be all giggly the whole time? No, you're going to behave yourself? For all of you out there who don't know, Nurse Bug is an ICU nurse. So she has seen a lot. Come here, Nurse Bug. She's so far away. She's hiding. All right, next topic, kids. You ready for this? Hemorrhoids. Who's got them? Who wants them?
No one wants them.
Get rid of them. Yes, hemorrhoids. So we'll do this for the nurse. Although Noodle is a medical assistant. So, what are hemorrhoids? Do you know what they are? Either one of you. I don't want to put Nurse Murray on the spot. What? Why are you? You're like, I'm just here to say hello to people. Hi, Rosie. Hi, Tala. Hi, Alicia. Does anybody want to tell me what a hemorrhoid is?
I'm gonna say it
You
wrong.
guys know what a hemorrhoid is? Somebody tell me.
From my little understanding, it's a little ball that's in where it needs to be, and it's just clogged up blood, and then they burst. I like a vessel.
Yes and yes. You're like both right. So there are internal hemorrhoids and there are external hemorrhoids. External hemorrhoids are what you're talking about. And internal hemorrhoids are what you're talking about. Right. So the hemorrhoid artery embolization, which is the minimally invasive procedure I do, is basically for internal hemorrhoids. External hemorrhoids, yes, it's like
Like
like that little ball,
Yeah.
right? And it's really hard and firm. And what that is it's an actual blood clot. What hemorrhoids are they are dilated veins, right?
Okay.
And because here in the US, our diets aren't always the best. So why are you laughing? It's the truth.
Make your Miralax.
Oh, I love Miralax.
Oh my god.
That's the good stuff.
Drink your water, take your Miralax.
I put Miralax in my coffee. You think I'm joking? I'm not. Yeah, veggies, water. We have a Western diet. We're not great at, doing what we're supposed to do. So, basically, okay. So I guess I'm kind of all over the place. What are hemorrhoids? They are swollen veins in your rectum or your anus. They cause bleeding, pain, discomfort, itching. And then when they bulge, like they prolapse. Those are the internal. The external ones are the ones that are very, very painful. Internal ones aren't necessarily painful, but they cause the bleeding. Like people say that they're doing a lot of bleeding. That's internal. But the external ones are the super painful because they're a thrombosed vein. It's a blood clot, right? And that's why it feels hard and stuff. You guys know, tell me, you give me two and you give me two causes of hemorrhoids.
Pregnancy and straining.
Yes.
I don't know. Pushing too. Well, that's straining. I mean, technically. No, it's the same thing. It's straining if you're pushing.
Yes, yeah. So pregnancy because of all that increased pressure on your pelvic floor, and then of course also pushing the boob up, and then straining. Straining during bowel movements, chronic constipation, or chronic diarrhea can both cause hemorrhoids. And now this prolonged sitting. So do you ever go in the bathroom and sit down and then nowadays people with their telephones who take their telephones into the bathroom, I feel like they'll get distracted and they'll sit on the toilet with their phone.
I find it perfect meditation for me. I live with my mom, so
wait, sitting on the toilet?
Yeah, if I'm done and I don't want to deal with anyone, I'm still in the bathroom.
But will you just hang out in the bathroom?
No, I'll hang out in the bathroom.
You'll sit on the toilet, or you just hang out in the bathroom?
Depends on my mood.
Okay. So that's not good for you. You can hang out in the bathroom, just wipe your hiney and get up and
go for a walk in the bathroom. Start jogging in the bathtub.
Or put the lid down and sit on that. So yeah, just prolonged sitting on the bowl is not good.
Okay, but you said sit if I put the top the cover down,
you can sit on top of the toilet.
So isn't that the same thing? Aren't you sitting? What's the difference between the hole and the not having the hole? Because you're your butt cheeks open.
Yeah, it's gravity and training.
Didn't know that.
Yeah,
something new.
But mostly constipation and straining. So those are the biggies. Those are the top ones. So people who get flare-ups, they'll do sitz baths. Do you know what a sitz bath is?
Spraying warm.
Yes. Do you know? It took me probably 3 years into medical school before I understood what a sitz bath was.
A lot of pregnant women do them.
I thought a sitz bath. Do you know what a sitz bath is?
A sitz?
Sitz bath is SITZ.
So I'm gonna say they're sitting in the bathtub.
No,
So they just add the Z at the place.
So it's like this little basin, and you can put it on your toilet, and you can basically like squirt water, like with a little bit of pressure. Yeah, I guess like kind of like a bidet, right? Am I describing it correctly?
A lot of hospitals will give you like squirt bottles that they'll have you sit on the toilet and whisper it and. Oh, I know what it is now. Yeah. It's like this little the squishy thing.
Yeah,
squishy bottle. Yeah, I know what that is. Your bottle, but yeah, I know what it is.
Right, it's got some pressure to it. For the longest time, I thought a sitz bath was like minerals and like salts and stuff that you put into your bathtub and then sit in.
Like sit virtual or something. Like you do like not like a
bath salts. Yeah. I thought they were specific bath salts for like your hiney. Like that's what I thought a sitz bath was. Why is nobody?
No,
is that so?
I wouldn't think it would be that. But I also said it incorrectly. It's not sitting down. It's putting pressure up. Not pressure, but it's
you sit. Yeah, like there's a basin and you sit on the basin, and yes, you're using a thing to like kind of put pressure, which I still don't quite understand. To be honest with you, I still don't quite understand.
Isn't it to clean?
Yeah, but it's also supposed to soothe you and like make you feel better. And I'll be honest with you, I don't 100% understand why that would make you. Do you know? Like, I mean, I'm asking honestly, like, why a sitz bath would like make you feel better.
Okay, I know a lot of women with episiotomies, like when they have those, like they do it after childbirth. They do it a lot. You know, hemorrhoids. I guess you could do it too, but
and it makes them feel better.
Yeah, I don't know what it is.
Yeah, I don't know.
I'm still wrong, but isn't that the one? It's like it's like this, right? Like it looks like that.
Or is that the basin?
The basin, and doesn't that have to go inside of your butt?
No, it's the outside. Goes inside of you.
So it's the outside? No.
No.
I know maybe there's one thing that they clean your colon.
Oh, you're talking about a colonic thing? Yeah. Are you talking about a colonic?
I don't know what it's called.
The barium?
So bad.
Okay, we don't do those here. We don't do colonics.
I thought that
we're gonna go somewhere else.
Are you talking about a Digna Shield? I have no idea what it's called. I know it's to clean your butt. I don't know what it's called. Like it's like a home. Like it's like a stick like this and then a circle on the bottom. They replace it. Okay, no. I know it's something like it's like who comes out?
Like an anal plug?
No, not that. I don't know what it's called. I know
this is gone.
I know it's
very R-rated. I
know it's to clean your butt. So I thought that was for the hemorrhoids. It's to clean.
Can you buy this in CVS?
Yeah. It looks like
we're going to CVS tomorrow.
It's like, you know the things that they used to do for the kids for their boogers?
Oh, yeah, like a baster?
Okay, so that, but for their butt.
A douche?
And they clean their butt.
That's not for your butt. A douche is not for your butt. A douche is for your lady parts.
I don't know where it goes. I just know that this thing is to clean. I use it. I don't know. I'm sorry.
I know that.
So that's why when you were talking about the hemorrhoids, I thought it was because of that. Because I don't know. That's why I was like, wait, but wouldn't that hurt?
What? Oh, the baster up your butt while you have a hemorrhoid?
I have no idea what you guys are talking about. I don't know what a sitz bath is. It's outside and nothing goes in.
Nothing goes in.
It's about this far away. And the pressure's it's kind of like a water gun.
Yeah. It's like a bidet. The closest thing that you can think of is
I'll just stay with the bidet.
Yeah.
Don't ask me any other questions.
However, we will be taking a field trip to CVS tomorrow. Noodle will be showing us exactly what she's talking about. And we'll tell you next week on TikTok Live.
I'm telling you, it looks just like the thing that they use for the kids when they're cleaning their boogers.
That is for your butt?
Yeah, it's to clean your... I thought it was for your... I don't know, maybe...
What aisle do you find it in?
I don't know. I found out through like social media or something. I was like, what is this? And then I'm like Googling this and I'm like, oh, it's for your butt. And then I thought, I don't know. I don't use it. So I'm like, okay.
Well, I promise you, audience, Dr. SK Talk Live audience. Did you know it?
Yeah, that's the.
What is it?
It's like that. It looks like that.
What is
Oh my gosh.
It's
to clean your
what is it? What is it? I'm excited.
It's loading. It's to clean your butt.
Oh, ooh.
But does that help with hemorrhoids?
It's a rectal syringe. What would you use a rectal syringe for?
It's to clean your.
Why do you need to clean your butt? Your butt's meant to be gentle effective cleansing. Health rectal syringe.
Oh, you can use everyone's in it.
Oh, okay.
It's kind of like a Digna shield outside the hospital. That's nice.
Okay. All right. So we have figured out what it is.
But does it look at the reviews?
What?
Let's look at the reviews. The baby.
Show. No, bring the picture back down and show everyone what it is so that they know.
It looks like the thing you use for the babies.
Yes.
It's like a Frito almost.
So it's basically a turkey baster for your butt. And it helps clean things out. So hey, look, you can't knock someone for wanting a clean hiney. I'm all for a clean hiney. So what? Oh, that one was aggressive. I don't like the looks of that one. Okay, let's move on. When do hemorrhoids need treatment? Occasional flare-ups are often managed with improving your diet. So Miralax, vegetables, water, creams, sitz baths, or
I don't know if it does that.
Rectal basters. I mean, I guess so. If sort of cleaning your bottom, like, yeah. I mean, if you have an external hemorrhoid, those are extremely painful. So I would not put something like that
that's
up
what I'm
there.
saying. I was like, I didn't understand that. I was like, wouldn't that be more painful?
Yeah, if you have an external hemorrhoid, that would be extremely painful. So don't do that. But if you have an internal hemorrhoid or a prolapse and you're trying to clean, just be careful. Don't puncture anything because then you can cause bleeding. You know what?
Don't use it.
I am not promoting.
Don't use it.
The rectal syringe. Don't do it. Keep everything on the outside, okay? Please. Just sitz bath, bidets, bathtubs. Get into a bathtub. Don't put anything up there, okay? It's only an exit.
No.
Only an out, not an in. Okay. Persistent bleeding, discomfort, or prolapse. These are all time to consider treatment for your hemorrhoids. And like we said earlier, many patients will avoid taking care of these things for embarrassment or fear of surgery.
You know how you fix prolapse? You know how you fix prolapse?
Well, rectal prolapse or hemorrhoid prolapse?
Rectal.
You tell me, bud.
Sugar packets. Look it up. I'm confused. This
TikTok got all of the rails. Sugar packets? What do you mean?
We'll look it up whenever we get done. What do you do with the sugar? We're in the ICU. You pour sugar packets on them. Back in.
Yeah, but when they poop, it's just going to come back out again.
Well, that's a story for a different day if you're trying to fix it like right now. Sugar.
You sprinkle sugar?
Wait, on someone's butt? Well, look it up, I promise. I'd rather talk about the sitz baths. I'm very confused today.
Me too. I've never heard of sugar. I mean, I started in surgery, in general surgery, and I had my hands and fingers up all sorts of butts.
I just thought of it.
I never ever heard sugar on somebody's prolapse rectum. Okay.
It's South Carolina medicine.
I didn't want to say anything. We do not want to look at my search on my phone after this. I'm with you, Donna. I agree too. Yeah, I know.
Too many questions.
Yeah,
ChatGPT is gonna go on fire.
My ChatGPT is gonna be like, Doctor, what's going on?
See a doctor.
Go to the emergency room right now. All right, Bug is showing Noodle the sugar packets. Really?
I have so many questions for you.
Okay. Well, we will continue our questions after, and we'll report back next week. Let's move on. All right, hemorrhoid Artery embolization. What is it? How do we do it? Okay, it's minimally invasive. It's non-surgical. It's a procedure performed by me, an interventional radiologist. If you've seen other TikTok lives, I talk about going in to the artery through your wrist or your groin, and then that's how I get to the places where I need to go, and I do the treatments that I need to do. So again, just like anything else, I'm going through your artery. I'm not actually in your rectum or anal area. I'm just in your groin or your wrist, right? And basically the whole behind any embolization that I do, the whole thing is I'm taking that tiny catheter to where it needs to go with a very specific spot, and I am reducing blood flow. And in this case, I am blocking the arteries that feed the hemorrhoids, and that's what causes the hemorrhoids to shrink. And I do that using microscopic particles. And now you might say, what's the question? The question is, well, if a hemorrhoid is a dilated vein, why is stopping flow in the artery helpful? Are you raising your hand?
No.
What's that?
Blood flow to brain stuff.
Yeah. Say it loud, say it proud, bug. Yes, basically, so the hemorrhoid arteries, they're effective for internal hemorrhoids because, you're getting bulging veins from, pressure, et cetera, et cetera. And what happens is it's the pressure from the blood flow. So we are cutting out, that pressurized blood flow, or we're slowing it down. We don't completely cut the blood supply off to the rectum or the colon because that would be bad. We also have collaterals to help, get blood supply there. But the specific ones that are feeding those hemorrhoids, we shut them down so that if the dilated vein can't get blood flow, it can't bleed, it can't hurt, it can't dilate anymore. So that's what we're doing. We're taking down the pressure. So it reduces the pressure and it shrinks the hemorrhoids by blocking the arteries. So it's pretty cool. And also by blocking those arteries, it helps for better venous drainage from the area. So that, again, that also helps the hemorrhoids to shrink. We're cutting off the fuel supply, basically, arterial fuel supply. So what are the benefits of hemorrhoid artery embolization over traditional surgery? Noodles. Oh, Nurse Bug worked in IR too, so. Come on.
One more time? I'm sorry.
They're too distracted. They're thinking about rectal tubes and basters for their butts. What are the benefits of hemorrhoid artery embolization over traditional surgery? Well, first of all, do you know what traditional surgery for?
It's outpatient service. Same day.
Yeah. Do you know what traditional surgery for hemorrhoids are? Bandings. They do bandings, hemorrhoid bandings. Do you know what that is? Mm-hmm. Basically, they go and you put rubber bands around.
It's castrating the hemorrhoids.
Yeah. So you go in from the bottom, the anus, and you get the bulging vein, and you tie it off
until it cuts off.
Right, and kill it that way, which is uncomfortable. And
then what's the? Oh, yeah. Never mind. Answer my own question. What? I said, what's the difference with the other one? You actually go inside and. Right, take the problem out.
My biggest thing when I was a surgical resident was I always felt bad doing anything with the patient's rectum or anus because there's no way you're going to not poop. In your recovery time. You know what I mean?
Oh yeah, I didn't think of that.
Yeah, you can't stop. So if you have surgery in that area, it's not comfortable, so the banding.
Even with the Miralax?
Well, it helps it, but you're still going through, you have to poop through those bands. You're banding that, and that's, and you have to get so that's why the procedure I do, no problem.
Poop away. Can it just, hurt in a way? If you're going to the bathroom, say you have, because it's a scalp, right? Technically, I'm thinking of it as, you're having a surgery, it's healing.
Well, yeah.
And then you're going to the bathroom, so it's scraping, not scraping.
Right, you're right. The reason why, the colon and the rectum, they heal well is because you have such a abundant blood supply that, those areas heal well. In IR, and I don't do this, but old school IRs, pelvic, like abscesses or fluid collections in the pelvis that need to come out and be drained, they used to do transrectal drainages. So they would take ultrasound up and put a drainage catheter through the person's rectum into the fluid collection. Because if you can't get through it, because our pelvis, we have bones on the sides and the back, and then in the front we have other bowel, and then there's arteries and other. So sometimes the fluid collection is really deep in the pelvis, and there is no way to get to it. It has to be drained. They go up through the rectum, and your rectum is has such good blood supply that it can handle that and it'll heal itself. But again, I would be like, who's the patient with the? Because basically you have a catheter hanging out of your rectum. But I don't do it.
Yeah,
I won't do it.
Patients that go through that.
No, I will always find a way, some other way. There are other routes, and I find it. I don't do that. So anyway, benefits of hemorrhoid artery embolization over traditional surgery. No cutting or stitches. No general anesthesia. Again, we do moderate sedation here, so I make you sleepy, I make you comfortable, you snooze, and then afterwards, Noodle brings you snacks. Outpatient procedure, same day. You come to beautiful IO or interventional vascular care. We get ready here. We do the procedure here. We go home from here. Obviously, less pain, faster recovery, no issues with pooping. You preserve your continence and your anal sphincter muscles. We all like a tight anal sphincter.
I actually don't know why, but I'm gonna let it be.
You don't know why?
Oh no, because I know you let it loose. I was like, why would you want your butt to be tight? I understood now. I'm sorry. I understood.
This TikTok live has gone off the rails, but that was my fault. I did that for Nurse Bug because I knew she was gonna laugh. I was waiting for Noodles to get there. Obviously, it's ideal for patients who are non-surgical candidates. There are some patients out there that can't get general anesthesia. If you can't get general anesthesia, you can't have traditional hemorrhoid surgery. So, who's a good candidate? Patients who have grade 1 to 3 internal hemorrhoids, especially with bleeding. If you have a lot of bleeding, we can fix that. Recurrent hemorrhoid symptoms, failed conservative treatments, want to avoid surgery or downtime. And if you've had surgery in the past and you have new hemorrhoids now, we can do this instead if you don't want to do repeat surgery. What's recovery like? Go home same day, minimal discomfort. Most patients return to normal activities in a few days. I mean, the only restriction is if I go through your groin, and you know this, Noodles, you know this bug. If I go through your groin, that's your femoral artery. I use a closure device here so that you can go home in a couple of hours, but I always say no heavy lifting for 1 week because we got to make sure that your artery heals properly. But that's really it. It's really my access point in the artery, not the hemorrhoid surgery. And the access point, again, is about the size of the width of my pinky nail. So that's it. No cuts, no scars, nothing like that. Results. Studies have shown that up to 80 to 90% of patients have significant symptom relief, and that typically improves in the first 1 to 2 weeks. You'll start getting improvement. So that's pretty awesome. Very low complication rate, and it can be repeated. So, unfortunately, just like with hair loss, unless you drastically change your diet and all that sort of stuff, if you've started down the road of hemorrhoids, you might get more hemorrhoids in the future, and we can repeat this procedure. Why you shouldn't ignore hemorrhoids. Chronic bleeding can result in anemia.
Yes.
Right. Just like with fibroids. Chronic bleeding with fibroids. I had a patient. She was coming to me for a UFE. She had a hemoglobin of 4. I sent her for pre-surgical testing to do the UFE. She had a hemoglobin of 4. I had to send her to the emergency room for transfusions.
You'll come see me.
Yes, I'll send you the bug. But yeah, it can cause anemia. That's how bleeding the bad can be. Prolapse, it'll worsen over time. They're just going to get worse. They're not going to fix themselves on their own. Even if you do Miralax and fluid and vegetables,
Yeah.
So don't be embarrassed and don't let embarrassment get in the way. Talk to your doctor, and any one of your doctors will be happy to help you and point you in the right direction. So, hemorrhoid artery embolization offers real relief, no surgery. If you're dealing with hemorrhoids, again, DM me. Call the office. All of the office information is in the bio. You can set up a consult. Oh, insurance covers it. I guess that's
key point.
Yeah, that's an important point. Unfortunately, with the hair loss stuff, insurance does not cover that. With anything usually cosmetic, insurance doesn't cover. Although Nutrafol, if you have, like an FSA, like an FSA, I don't know what FSA stands for. Is it like something like a health fund or HSA? Yeah.
What, supplement? No.
Right, yeah, it's a supplemental. You know what I'm talking about,
Funding.
right?
S8.
Or H8, HSA, FSA. When you get money that you
Flexible
can spend.
spending account.
That's it. Good job, Bush. You can use that for Nutrafol, because it's a nutraceutical and you have to buy it through physicians. So you can use that, but unfortunately the TED is not covered by insurance. But hemorrhoid artery embolization is covered by insurance. So if you have insurance, you come in, we can do a consult. And of course, like always, Noodle tirelessly calls the insurance company
Yes.
to figure out what's covered, how much you're covered for, and there's no surprises, and we tell you everything before we do any sort of procedures. So that's pretty much it. Does anybody have any questions? Otherwise, I think it might be time to wrap up.
Toodles.
Our TikTok live. Questions? Comments?
Not at the moment.
Well, maybe not comments. So, Bug, tell me, how did you like your TikTok live with Dr. S?
It was kind of interesting.
Are you scarred? Are you traumatized?
No, I work in the ICU.
Well, thank you so much for joining me in Noodle. I'm sure she'll be back again.
Stay tuned.
Stay tuned. Oh.
Very enjoyable.
Good. I'm glad. Miss you, Donna. When are you coming to New York to say hello? Hello. Anyway, from Ayur Interventional Vascular Care, I'm Dr. S. This is Nurse Bug. That's Noodles, and it's
time to Noodles.
all right, cats and kittens. See you next time. Bye.
Bye.